Good morning. Welcome, everyone. Welcome to the MorCare session on how to create a recipe for success, key ingredients for denial management in rural healthcare. My name is Beth Brand, and I am a nurse, and I'm also Vice President of Product and Customer Solutions with MorCare. We are a healthcare software vendor, and we are very happy to be part of NRHA and to be presenting to you today as we support our rural healthcare colleagues. Our agenda for today, we will start by setting the stage with a brief overview of the impact of denials management on your organization, followed by a recommended process for tracking and utilizing information which will enable you to make informed decisions regarding process changes and improvements. And then we will share with you how the MorCare solutions can provide value to your organization in denials management. One of the contributing factors to the financial struggles in rural hospitals, as you all well know, is due to the complex needs of the patient populations you all serve. Traditionally, we find that the rural population is socioeconomically disadvantaged in comparison to more urban populations. Patients often experience numerous health disparities and poorer outcomes than those served by more urban hospitals. Another key contributor is the payer mix. Rural hospitals deal with a larger percentage of Medicare and Medicaid patients. In some instances, as much as two-thirds of their overall patient population are government insured. This is an issue not only because reimbursement is often lower from those payers. Actually, in many cases, it doesn't even cover the cost of delivering the care, but also signifies a greater burden in that these hospitals must respond and react to the ever-changing government payment requirements. And the problem worsens as the complexity of claims intensifies. So we all know that the population is aging rapidly. We're seeing an older population on average with more comorbidities and chronic conditions. Population health management now means that health systems are transitioning more patients across multiple settings, thus requiring multiple claims. And truly, survival is the biggest challenge for rural hospitals today. Claims denials pose a serious issue. Both commercial and public payers are now denying anywhere from 10 to 40% of all submitted claims, and the denials can cost health systems up to 2% or more of net revenue. Not only that, but denials are very costly to manage and to appeal. One estimate is that it costs approximately $118 per claim just to work the denials on the hospital side. Let's think about that. Let's just take as an example. Let's say that you have that you at your hospital you experience a denial rate of approximately 20% of the claims submitted. And if the cost, as we have seen, to rework or to manage each of those denials is $118, then on average, if you have, let's say that your hospital submits 7,000 claims a year and 20% of those are denied, that results in 1,400 denials, and you multiply that by the cost to manage and to rework each of those, and you'll see that very quickly we arrive at amount $165,000. Think what that could do in a year. So it's a very significant cost issue for our rural hospitals. So we've talked about how denials create significant challenges for maximizing revenue. It's true that many hospitals are still using outdated processes or paper-based workflows for denials management. But given the fact that denials are on the rise, it really is important to have the right tools and processes in place. Technology can play a key role in curbing the denials issue, not only managing the denials process, but in truly avoiding denials from occurring in the first place. So where do we start? Well, although many of these issues are beyond our control, it is possible to improve financial performance by identifying root causes and then taking the steps necessary to correct. The hospital revenue cycle is complex. Effectively managing it requires transparency and constant communication between many departments. Streamlining the process is essential. So our recipe here is, first of all, and I can't say this enough, you all have heard probably the famous quote from W. Edwards Deming where he says, "What gets measured gets done." It's a favorite of mine and those of us at MorCare. And actually, we believe that, the first step is in tracking all those denials, making sure that you're capturing that information. Capture consistent data. So make sure that on every denial, you're capturing your payer, the denial types and reasons, the specifics of the denial, and make sure that as you set up your tracking process, that you have identified codes or categories that are going to make sense and going to provide actionable information as you aggregate that information. Once you have collected some data on denials, then it's really important to really study that and select the highest volume and the highest dollar denied reasons each month to focus on as you look to reduce or eliminate those denials. As we say in healthcare, it's important to treat the root cause, right? So it could be that that means that adding required fields in your registration screens, or adding billing edits, or putting system holds at certain points to prevent incomplete claims from going out, etc. But you need to really get at what is causing these denials, and then seek to fix that. Let's do an exercise here in analyzing the root cause of your denials. What you are seeing here is data from a recent nationwide study that was conducted by Change Health, actually. And their analysis identified these reasons as being the most common causes for claims denials in hospitals. And I have to say, from our experience here at MorCare and in our work with customers as we work with them on denials management, we do find that the data that our customers see from our system does tend to represent these same key reasons for denials in the hospital. So the first step, once you have your data, right, and you've got all of your denials are assigned to a particular reason code, and then that allows you to look across that data and understand what exactly are the reasons causing our denials. And the first step then is to look at where these things are happening. So which of these denial reasons are occurring prior to service, meaning they're occurring in the pre-registration phase, the registration phase, or in the eligibility identification phase, right? And if out of those, then you need to really dig in and see what can we do to change things. How can we make sure that our registration data is accurate, complete, and consistent? Does it make sense to have an alert system in place to identify potential gaps in data and establish workflows that then correct those errors in real time before that gets passed along and the claim gets out of the door? Also, eligibility. Some estimates are that registration and eligibility accounts for about 24% of all denials in the United States. So is eligibility being checked consistently? Is it checked often during the stay? What processes are in place to deal with patients who are not eligible or covered? The next step then, let's look at those denial reasons that are actually occurring during the service, during the care phase of the patient. So do you have appropriate medical necessity rules in place? Are physician advisors being utilized efficiently and effectively? Is education being provided to physicians on documentation issues that lead to inaccurate coding and therefore denials? Are medical directors being involved when peer-to-peer is needed? And then lastly, looking at that post-service phase, okay? This is looking at whether or not you have effective claims processing. It's really recommended that hospitals review claims both mid-cycle and before the claim is sent to the payer to look for errors and make appropriate edits. And if possible, edits should be customized to each payer, since each payer has different requirements for their claims forms. Review your edits on an annual basis and look for inefficiencies. It's important to keep monitoring what those edits are doing for you. And then there's your denials team. Involve the front, middle, and back end departments. Track denials, being sure to capture the payer, denial type, the service, etc., which will allow you to analyze the trends and focus efforts. And then, of course, appeal. Once leaders have identified where the problems are occurring, they should prioritize areas that will have the greatest impact on their hospital's bottom line. Not only the highest volume of denials, but the highest dollar amount. And as we said, drill down. Are there specific payers involved? Are you seeing a consistent trend? Are there particular service lines or departments? Are there particular physicians involved? Understand the dollar impact of inefficient processes or errors in each of these areas. And then this should be a constant process, just as with all performance improvement processes. We're all very familiar in healthcare with performance improvement. And as we all know, a data-driven process includes a discipline to measure and monitor, make changes and adjustments to the process, and then measure and monitor some more. While hospital leadership might have an understanding of the resources wasted and the revenue lost, and the case managers might have a strategy to improve performance, the staff rarely, if ever, see a report on denials. It's very few people in a hospital know what's actually going on in terms of the denials. They don't know what the denial rates are, and in many cases, they're not being asked for input on how they can help improve processes. Teams need access to reports to build action plans for improvement. If you have the data and teams are developing action plans and looking for improvement opportunities, they will find ways to reduce length of stay and cost and help improve quality and avoid denials. Remember, the best way to improve your denial rate is to prevent them from occurring in the first place. So having said that, we would like to talk to you, and I know this is a short session, but we'd like to talk to you just really briefly about MorCare and our solutions and how we automate the workflow for denials management and the audit process. So first, the most important step, as we said, is to get the denials posted or entered into the system. And then our system can utilize a really robust rules engine and schedule reviews, denial reviews, or appeals reviews, and then put those on very specific work lists. And those work lists are role based. So it depends upon areas of assignment and areas of responsibility, but we can generate just a wide variety of very specific to-do lists or work lists. Also, once in the system, the denial review allows the person managing that denial to have access to all of the medical necessity reviews and documentation that were done by care managers, the payer contact logs, including details on authorizations and denials, interactions with the physician advisor, and the tracking of any avoidable delays that were tracked during the stay. And something that we also feel very strongly about, it's not just about capturing the data. It's not just about, recording what's going on, but it's also about providing that information to the organization. So providing really robust reporting capabilities and making sure that actionable information is being provided for process and outcomes improvement. That's really what it's all about, utilizing that information. This is an example of one of our dashboards. This is a denials dashboard. And what you'll see here is in the upper, it's an interactive drillable dashboard. And you have filters. You can really filter the data, slice and dice it depending on where you want to focus your attention. But at a high level here, it's showing us trended denial volumes by month. And also at the same time, the actual initial denial amount and the recovery amount. So it really gives you a view into what's going on month by month. You can drill, of course, into this at any time and get very specific information about the denials within that month, all the way down to the exact encounters or patients involved. Also, as we said, it's important to look at your denials in the context of the insurers, and understand which, if there are particular companies that are causing the majority of your denials, or do you tend to have an area with certain payers, and that would, again, from an actionable information perspective, that allows you to focus in and deal with those companies where you have an issue. All of these quadrants here allow you to drill down so that I can look at For instance, if this is my Medicare denials, I can drill down and look at then what were the denial reasons for this particular payer and who were the patients involved. I also mentioned how it's important to be able to look at your clinical services. It might surprise you to know that sometimes some of your higher volume services have very low denial rates, while some of your lower volume services might actually have fairly high denial rates. And this gives you that overview, that picture, which then allows you to zero in and drill down. And if we had enough time, I would be showing you this dashboard in real time and show how you can drill down into a particular service and look by physician, by denial type, and also down all the way to the specific patients involved. And then last but not least, actually probably the most important, is that bird's eye view of the different denial types in your organization. What are the top ones for your hospital? They might be unique, you might not be exactly like any other hospital. So it allows you to see your denial types and then again, drill down and understand, get to the nuances of those so that you can figure out the root cause and make improvements from there. So in summary, we wanted to present, weren't given much time, but we wanted to present very quickly how managing the process of managing denials, and if it's not being done well, really can be costing you money. We really have tried to outline here a recommended process for leveraging the information that you can gain from these processes to better understand your denials, and then how we at MorCare can help you in this. We really feel that we have a solution that can provide value to your organization. We really, really hope that you will connect with us at www.morecarellc.com. We'd love to get to know you better. You can check out our site for articles, blogs, etc. But most of all, I would really love to have the opportunity to talk with you. Either myself or my colleague, Tina DeWeese, would love to explore with you how we might be able to provide value as you manage denials within your organization. Best of luck, and we hope you enjoy the conference. Thank you so much. Bye-bye.